Hi, everyone. Today, let's talk about virtual assistants and how hiring a virtual assistant in my perio and implant startup practice has been a complete game changer. So, first of all, let's explain what a virtual assistant is. It's not an AI or robot, this is an actual person. My virtual assistant also happens to be a dentist, and I've been with my virtual assistant for going on almost 2 years. And this isn't an idea that I had on my own. I'll be 100% honest. I was really skeptical. I was afraid to hire a virtual assistant because essentially what they do is they remote into your software and computer system and help with whatever you need. Now, my practice was set up so that people could remote in and out. And I'm really proud, but my office network and all of that is very secure because when I opened the office, my office manager that I used to have would remote in and help us with billing, claims, scheduling, and all that. So from the beginning, I made sure that my Wi Fi, IP address, and all that was secure. And so, understandably so, I was very hesitant to bring in a virtual assistant. So I heard about virtual assistants through my dear friend and colleague. Shout out to Dr. Han Bui. She's part of the Mommies in Dentistry group, and I just think they're super awesome. And they really promoted this company for virtual assistants. So my friend knew that I was struggling. She knew the areas that I needed help with, and she kept suggesting and trying to push me in the direction of getting a virtual assistant. And I asked her, well, what do they do? And she said, anything you need help with. They will help with whatever you need help with. And truly, that's exactly what happened. So I interviewed these assistants, and most of them are doctors. They can be in veterinary medicine, they can be dentists, physicians, but essentially they're trained to be virtual assistants. They go to school for this and they're taught about our software systems, for example, our charting software system, our billing software system. And I really needed help with notes and letters, not necessarily claims at that point. I am in network with some PPO insurances. So I didn't necessarily need help at that time with that. But I needed somebody to help me with notes and a lot of things that were taking up my time because as the practice grew from a startup, I started to get busier. And so I needed help. And I interviewed a lot of assistants. And then finally, I found somebody that I liked and we got to work. So I introduced to my virtual assistant what my practice protocols are, what my systems are, my software that I use, and we got to work. So now I'm going to break down what they can do, how they help me, and the office flow, as well as all of our team members. So we all know a lot of tasks can take up our current existing live in person team, whether it's your assistant, office manager, your hygienist, whatever it is. There's a lot of things that take up a lot of our time where that time really could be utilized for something else. For example, I really needed to streamline my letters. It was taking me a very long time to automate letters, input information, make the letter template exactly how I wanted. And so my virtual assistant was able to help with this. And then something else that my virtual assistant was able to help with is automating emails. So for perio offices, because we're referral based, we are requesting the reason for referral, any existing x-rays, and additional information. And also starting to put together the chart for that patient. So requesting their medical history, health history forms, getting their information as far as insurance goes, driver's license, and all that. And my virtual assistant was able to streamline this process so the emails are automatically sent from our software. And that has been a game changer. That has saved so much time, as well as streamlining my letters. So once I'm done with the consult or the post op or whatever, the x-rays are in the letter. I just have to type in a few things and we're done. Same thing for notes. My notes were able to be automized and that saves so much time. Could I have done it? Sure. Could a team member have done it? Yes. but it would have taken us so much time compared to how fast my virtual assistant is. Other things that they do is once I'm done with the consultation, I input the treatment plan and my virtual assistant calls the benefit company or insurance company and gets a breakdown of if the patient's eligible, the last time they used that code, different things like sedation can be tricky sometimes. So we get all of that in writing. We get the reference number, the agent's name, the time that we called in case, forbid that we have to dispute a claim, but it does happen, even as diligent as I am with notes, charts, x rays, everything. At least we already have that agent's information. And if we have to dispute, we can include that in that dispute. And then what else? Honestly, anything I need. It can be as simple as helping me check into a flight, writing. We have a communication log in each patient's chart. So making sure that we send all of the prescriptions, that we've answered everybody's question. If it was a weekend or evening, all of those voicemails get logged in the patient's chart by my virtual assistant. So that's been very helpful. What else? Honestly, I think that's a gist of it and like the meat of it. My virtual assistant is full time 7 to 3. They log in at 7, log off at 3. If you're interested in a virtual assistant, here's what you need. So, you need some type of software where they can remote in, whether it's like AnyDesk, TeamViewer, Ring Central is another one. I don't recommend. They're so bad. But there's different systems. You need something where they can remote into a computer, and you need a free computer where they can remote in to do whatever they need to do for you. And also, you need to add them into your system as an employee. Some issue as an employee. An issue that we had in the beginning were insurances were, oh, no, and adding that information as well. When they're calling insurance companies, it pulls up as your office phone number because you don't want it to be some random number. Insurance companies are going to be calling you and bothering you, asking if this person is your employee or not your employee, which is not what you want. Something else that you need some way of communicating. I don't like Microsoft Teams personally. I like Google, Gmail, G Suite, and all that. And that's been great. I also use another company for HIPAA purposes, making sure that everything is secure, patient information is protected, and that's been great. And other than that, not much. I highly, highly recommend. I'll comment down below the company that I use. There's lots of companies out there. I would explore, do your research, do interviews, and then find somebody that's a good fit for you. I happen to stick with the first person that I hired for a long time. This is just like any other employee. You have to go over goals, expectations, and communicate so much. You can't just expect that things are going to get done without you communicating how you want things done, what you want done, and all that. So, yeah, that's been my experience with a virtual assistant. I can't recommend enough. Anything from updating my office manual, updating my patient health history forms, consent forms, it's just been a total game changer, like I said. I want my practice to run as smooth and efficiently as possible. And yes, I can do the work myself. A team member can do the work myself. But the way we see it in my practice is we're all a team. And even my team members lean on my virtual assistant a lot for different software stuff, logging in into the computer if they're remoting in. So, yeah, it completely changed. It freed up a lot of my time. I highly, highly, highly recommend. So, that's my 2 cents on a virtual assistant. I hope that helps. So, to summarize, in my office, my virtual assistant helps with billings, small claims, any type of petition, calling insurance companies, entering patient information, entering existing conditions, gathering all the data that we need from referrals like x rays, reason for referrals, creating charts, sifting through charts. Also, we have Google spreadsheets of patients that need to be called, recall patients, patients that haven't scheduled surgery, new patient consults. So, updating that sheet that would take me forever, my front forever. They help with that and auditing too. So it's always good to have a second set of eyes. So highly recommend. If you have any questions, ask me down below and I'm more than happy to help. Bye.